Hello, it's NurseEdScholar, and as nurses, we are the guardians of our patients' well-being, and a critical aspect of that responsibility lies in understanding fluid and electrolyte balance. Our bodies rely on a delicate equilibrium of fluids and electrolytes to function correctly. Disruptions to this balance, often caused by illness or injury, can have significant consequences for our patients' health. These disruptions can manifest in various ways, including dehydration, overhydration, and electrolyte imbalances. By grasping these concepts, we equip ourselves to identify potential imbalances early on, implement appropriate interventions, and advocate for our patients' well-being. In the following sections, we will delve into two specific conditions that disrupt fluid balance: third spacing and edema. Imagine a bustling city with a well-organized traffic system. Cars flow smoothly, delivering people and goods where they need to be. Now imagine a traffic jam, where cars are stuck, unable to reach their destinations. This is akin to what happens in our bodies during third spacing. Third spacing occurs when fluid shifts from the bloodstream to the space between cells. This fluid becomes trapped and is no longer readily available for use by the body. Think of it as fluid being lost within the body, even though it hasn't actually left. Factors include increased capillary permeability, low albumin levels, and lymphatic obstruction. Increased capillary permeability allows fluid to leak out. Inflammation, allergic reactions, and sepsis can cause this. Low albumin levels occur in liver disease and malnutrition. Albumin helps keep fluid within blood vessels. While third spacing might seem straightforward, assessing it in our patients can be surprisingly challenging. Unlike dehydration, where signs like poor skin turgor and dry mucous membranes are readily apparent, third spacing often presents with subtle and nonspecific symptoms. This elusive nature stems from the fact that the fluid is not lost from the body, but rather sequestered in a space where it's not easily measurable. Traditional methods like monitoring urine output or assessing for edema may not accurately reflect the extent of fluid shift in third spacing. The challenge intensifies because the signs and symptoms of third spacing often mimic other conditions. For instance, a patient with third spacing may experience decreased urine output, which could easily be mistaken for dehydration. Similarly, weight gain, a common indicator of fluid retention, may not be significant in the early stages of third spacing. By carefully piecing together the puzzle of patient presentation, we can improve our chances of detecting third spacing early and initiating appropriate interventions. Edema is another term for swelling, is a condition characterized by an abnormal accumulation of fluid in the interstitial space, the spaces between the body's cells. This fluid buildup leads to swelling, which can be localized to a specific area or generalized throughout the body. Understanding the causes of edema is paramount in providing effective care. It's not a disease in itself, but rather a symptom of an underlying condition. Several factors can contribute to edema, including increased capillary hydrostatic pressure, decreased capillary oncotic pressure, increased capillary permeability, and lymphatic obstruction. Increased capillary hydrostatic pressure refers to increased pressure within the capillaries, forcing fluid out into the surrounding tissues. Heart failure is a common cause of increased capillary hydrostatic pressure. Decreased capillary oncotic pressure occurs when there's a decrease in the concentration of plasma proteins, particularly albumin in the blood. Albumin helps to retain fluid within the blood vessels. Liver disease and malnutrition can lead to decreased capillary oncotic pressure. Localized versus generalized edema. Edema can manifest in two primary forms: localized and generalized. Understanding the distinction between these forms is essential for nurses, as it can provide valuable clues about the underlying cause and guide appropriate interventions. Localized edema is confined to a specific area of the body, such as a limb, joint, or organ. This type of edema often results from injury, inflammation, or venous insufficiency. Injury, for instance, trauma to a specific area, can cause localized edema due to inflammation and fluid accumulation. For example, a sprained ankle typically presents with localized swelling. Inflammation from infections, allergic reactions, and autoimmune disorders can cause localized edema in the affected area. For instance, a bee sting often results in localized swelling around the sting site. Venous insufficiency, when veins in the legs are unable to efficiently return blood to the heart. Fluid can accumulate in the lower legs and feet, leading to localized edema. Implications for nurses. Here's how these concepts directly impact our nursing care. Assessment. Nurses are often the first line of defense in identifying patients at risk for or experiencing third spacing and edema. Close monitoring of fluid balance is crucial for patients with third spacing or edema. This includes monitoring intake and output, weight, and edema progression. Interventions. Nurses play a vital role in implementing interventions to manage third spacing and edema. This may include fluid restriction, medication administration, such as diuretics or albumin, and elevation of affected limbs. Educating patients and their families about third spacing and edema is essential. Here are some valuable assessment tips for nurses. Obtain a detailed medical history, including conditions like heart failure or kidney disease. Review medications affecting fluid balance, such as diuretics. Monitor vital signs for changes indicating fluid shifts. Monitor daily weights. Rapid gain can indicate fluid retention. Assess for edema by pressing on the skin over bony prominences. Recognizing at-risk patients allows us to proactively implement preventative measures and closely monitor for early signs of fluid imbalance. If you enjoyed this video, please like and subscribe for new content. See you next time from NurseEdScholar.